Imagine you are living your life. One morning, you wake up and it takes you double the time to scramble your eggs because your hands are stiff and tender. The Saturday hiking on the islands is off because your knee decided to get swollen. You struggle at work because you couldn't sleep all night due to that back pain, which would wake you up hour after hour. Say you do everything right. You go to the doctor, get your diagnosis, get your medication, take time off work or school to take care of yourself, and yet all of these annoying symptoms don't go away. What I've just described is what happened in 50% of patients affected by psoriatic arthritis, a big word which underlies fingers which look like sausages, tender and swollen joints, scale on your skin, and fatigue. As I said, even when promptly treated, you don't always get it under control, and that interferes with the quality of your everyday life and on the healthcare system of your own country. What if I told you we could have seen that coming? Or even better, we could have prevented that from happening? Well, that is exactly the gap my research is trying to fill. I say we could have seen that coming because psoriatic arthritis is preceded by psoriasis years before that. Psoriasis is a skin disease where you get patches on your elbows, scalp, knees, and patients affected by psoriasis gives us the unique window of opportunity to study who among them will develop psoriatic arthritis over time. How big are we talking about? Psoriasis affects 2-3% of the worldwide population, say all the inhabitants of UK, France, Italy, and Spain together. After 7-10 years, 30% of them, say all the UK, will develop psoriatic arthritis. How am I trying to interfere with that? To do that, I take tiny pieces of diseased tissue in the clinic, we call that biopsy, and I cut it in the lab to obtain separate cells. Then, I ask at each and every single cell who they are, in medical terms, what genes they are expressing. And putting together all those big data, I obtain a gene signature. Imagine it as the specific fingerprint of the patient. Once we've measured the fingerprint, we need to understand it. For instance, some, and our culprit here is the fire, will propagate over time, which means that the fire patient with psoriasis will develop psoriatic arthritis, while others, as the daisy or the snowflake, will never evolve to arthritis. Once I know what the fire is, I want to extinguish it using the ideal hydrant, or as doctors like to call it, precision medicine, to target the specific fingerprint. My hope, prevent arthritis from happening and eventually saving your Saturday hiking in the islands. Thank you.